Hi, everyone. Welcome to the last day of the Ken Kennedy Institute Data Science Conference. This is day 3. First, I would like to announce our poster awards. We awarded posters for 4 different topics, basically overall poster presentation, use of visualization, potential impact, and use of public data. Our 4 different awardees come from all over the country, or actually all over the continent in one case. We had 25 submissions in total. Each of them submitted a 3-minute video. I encourage you to go back and watch them talk about their research. But the winners will receive a gift certificate, some t-shirts, and a coffee mug in the mail, hopefully soon. Being our last day, I want to remind people that recordings of all the talks can be found in the application for the next week. And so if there's anything you missed or you'd like to rewatch, please go back and watch. You can also still connect through with other attendees for meetings if you choose to do so. In the coming weeks, the talks will also be added to our YouTube page. So, the content will always be out there. I want to thank you for being part of this effort, whether or not you're a speaker or an attendee, that we really appreciate it. Today is something special and new that we've done. Basically, it's around a special collaboration track that was started between Rice and MD Anderson about several months ago. And what today for us is a lot of it is basically trying to continue that conversation, but also share what we've learned with the rest of the community the last couple of months. Today we'll cover a number of things. The first 3 are 3 talks. I'm going to talk about nuances of virtual collaborations, tools that we liked and tools that we didn't like, and help other people start their own collaborations. Then Dr. Carolyn Chung from MD Anderson will talk about something she calls brainstorming, which is really kind of an interesting way to do collaborative problem solving and learning that is even helpful in the digital environment. Finally, Dr. Andy Futrell from MD Anderson will talk about the D3CODE effort, which is really one of the major focuses of today. Our next 2 sessions will be rapid fire talks, starting with MD Anderson and then Rice University. And this is actually a lot how people have been coming from the virtual collaboration. It's just let's, everybody do 5-minute talks about what they do and care about so that, we know who to connect. Finally, we'll be ending with a panel called Building Collaboration in the Middle of a Global Pandemic, Why, What, and How. Dr. David Joffrey from MD Anderson will be leading this panel, and based on the discussion yesterday, I expect it to be lively and interesting. And I suggest everybody go back and watch the panel from yesterday if you have a chance. It was really great discussion around data. But again, we'll be sharing, the things that we learned along the way at this panel. What is the Ken Kennedy Institute? We're this computational sciences institute at Rice that really focuses on solving big problems, and big problems really need large community efforts nowadays to solve problems. We focus on, research in AI and data science, building new technology, training the current and future workforce. We like the ideas of, the ideas in academia making into industry, but one of our major focuses is around developing partnerships in academia, industry, and community. And that's really one of what we're going to talk about today. Collaboration is important. It helps us be better problem solvers. It helps us identify the problems that we should solve. It, brings people and organizations closer together. And when this happens, it increases the channels of communication, which then should lead to more collaboration. But at the end of the day, collaboration should make us more efficient. We also learned this last few months, collaboration is hard. We need the right people for the right problems. Research goals need to align. There's a lot of paperwork for multi-institutional efforts, and I'm glad it's not necessarily all my job. It's very hard to share people and data across institutions easily. And I really want to emphasize data sharing is not easy. And I guess when we're talking about people data, probably it shouldn't be. But because of all these problems we discovered, collaboration is not always efficient. But we're hoping through this process, what we will learn is basically ways of making it easier in the future, not just for our own institutions working together, but help us basically work with other institutions well, and maybe continue to pass these learnings on. How did we end up here? I would say we started talking to David Joffrey of MD Anderson, which is the Chief Technology Officer and Digital Officer at MD Anderson. And he's also a professor in I think imaging physics. But during these conversations, it was very clear that there was a synergy, that, MD Anderson has, lots of interesting things that they would like to work on, the same with Rice, and we decided to focus on this D3CODE effort, which I'm gonna let, I'm not gonna say too much about it because Andy's gonna go into detail later, but from my point of view, just kind of a quick overview, the idea is, what do we do with people who have COVID and cancer? I mean, at MD Anderson, they need to make decisions about their patients who already have compromised immune systems, who have cancer, but then you start adding in this new confounder. Should you treat them differently? And how do you make your decisions better? We decided a good way to start out is a workshop, just to introduce the faculty from each of the institutions. But in the dream world, last year we would have had a nice wine and cheese event, and everyone would have met, and hopefully we would have seen some kind of collaborations bubble up. But we now live in a digital world. So the first thing we did was basically create this kind of webinar to introduce the two institutions, but introduce them to the idea that we're going to collaborate. This is, how we're going to come at it, and what is our vision for this. MD Anderson talked about a lot of their efforts around data organization, data sharing, data normalization. MD Anderson also talked about their D3CODE effort. Then a number of professors from Rice talked not only just about the research, but a lot of the research that goes on at Rice University. And then again, we introduced, this idea that we're going to have a workshop. We had to decide how we have this workshop. And I think today there's a lot more tools, but we were kind of back in June, July, and our options were limited. And the first thing you might think is Zoom. Well, a lot of people are trying Zoom, and I do think some have made it work, but we didn't want to just drop 50 people into a Zoom meeting and try to navigate that. And we didn't want to create just, 50 separate Zoom meetings, because that doesn't, allow for any of those organic experiences to happen where someone gets pulled into a discussion they wouldn't have normally had. So we started looking at different options of technology. Spatial Chat was one that came up early, and I actually do like it, but it wasn't a very good fit for us. But it's it has this cute little environment where when you log in, you can have a pretty picture, and basically you log in and you're an icon, and basically the placement of your icon decides kind of who you talk to. And so here in this picture, this is basically 4 different groups of people talking, and I can basically move myself around the screen based on who I want to talk to. I do think there's a good place for this where, maybe it's a kind of virtual coffee or virtual happy hour, but wasn't a very good fit for a workshop. The next thing we found was something called GatherTown. And the thing we liked about GatherTown was it basically kind of simulated the idea of being in a big room and that you move around this room. So when you log in, you basically end up having a little icon that's in the middle screen, and you move around, you can move around the room. And when you become close to another person whose icon, a Zoom session will open up. And one of the other nice features about it was you could build rooms, and then these rooms became kind of automatic Zoom sessions if you walked into it. One of the reasons why we really liked this was because it kind of hopefully created that organic conversation that we were hoping would happen, that you'd be walking across the room and see somebody you hadn't seen for a while, or maybe you had some free time and you just introduced yourself to someone. This is kind of what it looked like. And here, it's you basically, here's your room, here's the people you're talking with. And then again, another example, we're kind of in the middle room and you kind of come in contact with somebody, and that Zoom session just opens up. Over 2 days, we set up about 50, 60 meetings that happen between 18 projects at MD Anderson and 23 faculty at Rice. And well, there was good and there was bad. People did seem to have fun. It was kind of fun watching the faculty move about the room. And whenever I did run into them, they, a lot of them had big smiles on their face and were like, I gotta go, I gotta be, I have a room to be at. People seemed to bond over this new experience. When they showed up in their new room, they could talk about the craziness that we had just introduced in their lives. And it definitely created that more organic feel we were going for. The bad, there were technical difficulties. Some people couldn't move. Some people had to keep logging in. The software was a little clunky, but at the same time, this was, there really weren't a whole lot of options during the summer. And so we were, happy with it. We were overall happy with the experience, but the making this map was actually time consuming. Since then, a number of other softwares have popped up. I mean, Gatherly is something I would have definitely considered a couple of months ago. It has a little bit more easy way to make rooms. When you want to be in a room, you kind of click on a seat and then you appear and you talk to those people in that room, and it's easy to move in between. Another software I really like is Remo, which I think we will be using in the future. Same idea. You can basically build all these rooms. When somebody wants to come in and interact with, have an interaction, they can basically drop into a room and basically a Zoom session opens up. But one of the nice features, you can also integrate small talks into this. So you can jump immediately into networking, then have a 15-minute talk, go directly into networking, and then have a small talk again. And basically what happens, the screen pops up and basically everybody can see the talk. From our workshop, we saw a number of collaborations bubbling up, and I expect that we will keep on kind of moving this along. But one thing that we will be doing different is we're hiring a data scientist to help this collaboration move forward. That, one of the things that we learned from this experience is it's very, very, hard to basically get things started. And especially with something as important as, what's going on with COVID, we want to help move this project along and make as much progress as we can, so that we can help have an impact on patients.